Hey, my name is Dr. Sean Price, Clinical Coordinator here at Cairo Spa in Fort Walton Beach, and I'm doing a 6-part video series on how to achieve optimal health and ultimate health. Last video we talked about stress and how that can affect the body, and today we want to talk about the brain. The brain is critical. The brain is obviously the most important organ in the body because it's completely engulfed in bone, so the body innately tries to protect the brain and keep it as safe as possible. And the brain controls and coordinates the function of every single cell in your body. The brain is the distributor of our life force. If your brain does not work, your body does not work. There are so many examples of this that I can give, but one of the simple examples is if you have a cut in your finger, the brain controls all of the functions that happen to heal that cut. The platelet laydown, the thrombocyte production, the laying down of the skin. All these things happen, and all that happens through neurological coordination. So the brain is critical, and the brain has to be able to control and coordinate those functions. Well, what can affect the brain negatively? Well, number one, inactivity can affect the brain negatively. If you're not stimulating the brain, you can start to lose function in the brain. Number two, you can have chemical exposure. All these stressors that we talked about in the first video, those can have effect on the brain. Stress itself has an effect on the brain. Increased cortisol levels love the temporal lobe of the brain, and that can lead you into short-term memory loss and a lot of different issues like that. If it gets too far into the brain, into the hippocampus, you start dealing with issues with dementia and things along those lines. So stress definitely negatively affects the brain. You can see a diagram that I drew here. We call this the brain-body diagram. And the brain works in two different ways. Number one, it sends a signal to the body. Okay, so it sends a signal out to the body. We call that efferent communication. The other thing that the brain does is it gets the feedback from the body coming to the brain. That's what we call afferent communication. So the brain gets the feedback from the body about what's going on, how's the muscle tone, how's the environment, are we hungry, how's our hormone balance, how are all these things happening, and then the brain sends a signal out to control and coordinate all those functions. So any breakdown in the neurological system, any breakdown metabolically that's affecting this signaling, any breakdown that's affecting how the brain and the lobes of the brain are functioning are going to affect the entire body. And the brain controls a stress response, so you can actually start a negative spiral if you start having a stress response that decreases brain function. Well, what can be done about this? Wonderful, wonderful technology out there called functional neurology. We use that in our office with patients daily. And what that is it's using neuroplasticity to increase, it's called fuel and activation. So we use fuel and activation to produce neuroplasticity in the brain and rebuild those functions that have been lost and rebuild the body's and the brain's ability to function. Following all the steps that we're going to be laying out in this next 6 videos, those will all help with brain function. So the brain is critical, and a lot of times if you're not feeling as good as you should, it comes from decreased brain function. And like I said, there's a lot of things that we can do about that. All right, hope that makes sense. And again, any questions, please feel free to post them below.